So you're going to have a breast reconstruction with implants. Maybe you're doing this for prophylactic reasons, such as being a carrier for a breast cancer gene mutation, or maybe you have breast cancer. In today's video, we're going to discuss some important things you should know about implant-based reconstruction, such as how does an implant reconstruction differ from a breast augmentation? What are the risks and limitations of an implant-based reconstruction? And who is the ideal candidate for an implant-based reconstruction? Hi, I'm Ramon Garza. I'm a board-certified plastic surgeon who specializes in complex breast reconstruction and aesthetic surgery of the breast and body. I make educational videos related to plastic surgery. So how does implant-based breast reconstruction differ from a breast augmentation? I sometimes have patients who have had a prior breast augmentation surgery and they assume their breast reconstruction experience will be similar to the breast augmentation surgery. Unfortunately, that is not the case. In a breast reconstruction, the anatomy of the breast has been significantly altered in that the breast tissue has been removed entirely. This means that the implant in a reconstructive case will have significantly less healthy soft tissue covering the implant. The implant is also closer to the skin surface, and there are less support structures to help keep that implant in position. What does that mean as far as results? It means that an implant can become more visible in a reconstruction compared to a breast augmentation, and that there is a higher risk for complications related to the implant. For patients who undergo breast augmentation surgery, the risk of having a complication or repeat surgery over a 10-year time frame is less than 10%. For breast reconstruction, that number jumps up to 50%. The most common complication that we see is capsular contracture, meaning that the scar tissue that forms around the implant becomes tight, fibrotic, and sometimes painful. This can change the shape of the implant and in worst case scenarios become painful. So who is the ideal candidate for this procedure? In my experience, the patients who get the best aesthetic outcomes are those that have smaller frames, lower BMI, and want a smaller cup size. A large, heavy implant in the setting of reconstruction can cause long-term issues, including having the implant migrate out of position. Our bodies are not designed to support heavy implants, and the larger the implant, the more stress and strain it puts on the soft tissues. In my opinion, implants that are larger than 500 cc's are at higher risk for this. So if you're going to have an implant-based reconstruction, try to choose an implant that's below 500 cc's. And now for a bonus tip. If you're going to have an implant-based reconstruction, discuss with your plastic surgeon where the implant will be placed, specifically relative to the pec muscle, below the muscle or on top of the muscle, which we call pre-pec. Most recently, higher volume breast reconstructive surgeons are opting to place the implant pre-pec or on top of the muscle. I prefer this as well for multiple reasons, including less pain and no animation, which means movement of the implant whenever the pec muscle is contracted. If you enjoyed this video, make sure to like and subscribe to our channel. Check out our website at drgarzaplasticsurgery.com and follow us on Instagram. Comment below for questions, or if there are other topics you'd like to see us cover, let us know in the comments. Thanks.